On ka na, diba? On na.
Okay na.
Okay na. Game, so yan.
Good day. Our topic is about infectious diseases. And we're now going to interview Dr. Maria Rosario Pedraza Javier, a pediatrician, diplomate, Philippine Pediatric Society.
What was the most infectious disease that you have handled that was caused by a microorganism?
Let's make it this way. Let's talk about an infectious disease which is common. Is that okay? Because if you say most infectious disease, you'll have a lot of things. We'll have a lot of things to talk about. So let's talk about an infectious disease which I think you have encountered or I have encountered in a lot of cases in my clinic. So let's talk about Entamoeba histolytica or amoebiasis or amoebic dysentery. So the disease is called amoebic dysentery, and the microorganism that causes it is what we call Entamoeba histolytica.
What is about the disease that made it infectious to you? What will happen to the patient having that disease?
I consider this an infectious, I consider this one of the most infectious diseases I've encountered because it is very common, not only in our area, in Binangonan, but in a lot of places in the Philippines and in developing countries. So what happens to the patient during the disease? We call it amoebic dysentery. Dysentery means diarrhea, bloody and mucoid diarrhea. So the amoeba, or the microorganism which we call Entamoeba histolytica, will attach to its. Let's talk about the name so that you'll understand it. Amoeba is a single cell organism which changes its appearance, and histolytica means the tissues. Okay, so the amoeba, the microorganism or the bacteria, enters or attacks the tissues of the intestines, the gastrointestinal tract, basically the large intestines. So it affects the intestines, it affects the tissue lining of the intestines, and it can cause bleeding because it destroys the lining, the tissue lining. So it's dysentery, we call it dysentery when there is bleeding. So it causes diarrhea, dehydration, bloody diarrhea specifically.
What are the characteristics of the organism that caused the disease?
Yeah, I think that was what I was talking about. So it invades the large intestine, the lining of the large intestine. And you can understand the illness based on the name per se. So what happens? The child gets the infection. Usually the person, not only the child, the person has fever most of the time, will have diarrhea. Some cases, when the microorganism does not invade or touch the tissue, it just stays in your intestines. If that happens, then it's not going to do any harm. You won't feel anything, but it stays there. So some patients or the old people would say, hindi gumagaling ang amoeba. Because it's always there. Sometimes you become a carrier. The organism is there, the load of the organism or the bacteria is there, but you do not get the symptoms of the disease. Only when the organism touches the tissue and it destroys the tissue will it cause the symptoms. And the symptoms are, as in any infection, there is fever. Fever just means your body is reacting to the insult, whether the virus or bacteria. That's the only thing the fever shows us. You are reacting, you're fighting off whatever infection. Number two, since it invades the intestines, you will have diarrhea. And usually it's bloody and mucoid, yung may phlegm na diarrhea. You have severe abdominal cramps, you'll have loss of appetite, fever, vomiting in some cases, and as complications of any other diarrhea disease, you'll have dehydration and it can cause death. The sad thing about Entamoeba histolytica is it primarily affects the intestines, but it can also affect the other parts of the body. Since it goes through the tissue, it can go to the other parts of the body. It can invade the liver. We call it it can affect the liver, and it can cause foul-smelling discharge. It can go through the diaphragm. The liver is on the right side. After the liver is the diaphragm. It can go through the diaphragm, go to the lungs, go to the heart. It can even go to the brain. So the common things that we see, the common patients we see are just amoebic dysentery affecting the intestines. But sometimes they can invade all the other parts of the body.
So, are there any possible ways to cure or treat that disease?
Oh, definitely. There are medicines that can treat the disease. But let's start with avoiding the disease, right? This is basically food and waterborne disease. So if you understand what the organism is, you'll understand how to treat and avoid it. It's a food and waterborne disease. So it doesn't stay in other organisms. It doesn't, unlike the dengue, which has a carrier, meaning it needs the virus has to be carried by a mosquito before it affects the human being. This one is from human to human. So it is food and waterborne. It stays in the intestines, goes out through your feces or your stools. And when hygiene is not very good in your community or in your home, the flies can go to your stools. Sanitation is not properly practiced. It can go, the mosquitoes can go through the stools and go to your food or go to your drinks, your glasses, or you can touch, can play, and then you don't wash your hands, and then things can happen. So it's basically a food and waterborne disease. So prevention is basically good hygiene. Distilled water, eat cooked food. Salads are okay, but they have to be very properly washed. When the disease already hits you and you get the symptoms, then you'll have to take care of the symptoms, which is the fever, the pain. You'll take care of the fever with your usual analgesics or paracetamols. You'll have to take care of dehydration, because when you have diarrhea, you pass out a lot of stools, a lot of water, so you have to take your oral rehydration solutions. But the main therapy is a drug which we call metronidazole. That's a classic drug, metronidazole. You take it for 7 to 14 days and you're okay. There used to be another drug before. I'm not sure if it's still available in the country. I think it's furamide diloxanide. We used to use it before for carriers. We have carriers such that it's there in your body. So it's very controversial. Some of them will treat it, some will not. I personally do not treat carriers. Carriers means you don't have the symptoms, but when you do a stool exam, you'll inadvertently find amoeba in the stool exam. So we used to give diloxanide or furamide, but the main therapy is supportive therapy for the symptoms and metronidazole. And avoidance, because it's a food and waterborne disease, you have to be very careful about sanitation. There is no vaccine available for it, so that's the sad.
Have you encountered a patient that has this infectious disease?
A lot, JM. I've had several. I have a lot of dysenteric patients, but the worst patient I've seen, and this is very memorable for me, was when I was still a resident. I was still doing my pediatric residency in PGH, and this was, I think, a 12 or 13-year-old boy who lived in Bicol, and he was having bloody diarrhea, but he was okay. He was helping his parents. He goes to school, but he was helping his parents in the farm. So I think the hygiene is they poo and they pee in the fields, and they're not very conscious about sanitation. But he was okay. He didn't bother. He wasn't very much bothered about the bloody stools, because the classic symptoms of amoeba sometimes is that you don't really poo a lot. You don't really pass on a lot. It's just bloody, it's mucoid, and it's in small amounts. So, and sometimes it gets gets a little better and you think you're okay, then after a day or two you're there again. So he, I think, was having his symptoms for a couple of months. But when they brought him to PGH, he already had a big tummy. He was already yellow. He was jaundice. He was yellow. So we were thinking it was already affected. And we didn't know it was a liver. We were thinking he had a liver problem. So we had things done in the liver. But when we found out, when they got fluids from the abdomen or the stomach, then they got amoebic fluid. It's practically poo in the tummy. And he still wasn't able to breathe properly. We thought he was going to be a little better because he couldn't breathe because of the very big stomach and he was very much febrile. So we were looking at the liver. The liver, we didn't see anything. Then the chest, they found out that there's also fluid or water material fluid in the chest. So when they did tube in the chest, there was also a big fluid there. And that was what I was telling you. It already, it went to the liver, traversed the diaphragm, went to the lungs. And we thought it's going to be a little bit okay because we removed the fluid in the lungs. He still wasn't breathing well. There was fluid in the heart, in the pericardium or the sac of the heart. He survived for a couple of days, but he died. So that was the worst case. So it can happen. So I'm very passionate about this when I see patients because I've seen it happen, the worst happening to a very strong, nice boy. And since it's very contagious or it's very infectious, we found out that his siblings also had it. It wasn't just as bad. So we were able to take care of the siblings, but we lost the boy. We lost the boy. Any more questions?
Thank you, Dr. Rose Javier, for answering all our questions.
And that ends our interview.